When we do a cervical disc replacement, we do come in from the front of your neck. We make a small incision off to one side of the neck, localizing over the area that we're trying to access, which we determine based upon an X-ray when you're asleep and positioned on the operating table. We have to move a couple structures, namely the trachea, your breathing tube, and the esophagus, your swallowing tube, over the front of the spine to allow access to the disc space. Once we're at the surgical level, and we confirm that intraoperatively, the bad disc is removed. We take it out entirely. Often, we also have to increase the space because typically the level was pretty collapsed. And we accomplish this by putting pins in the surrounding bones, and it allows us to use some devices that open that space up to restore the height of the disc to what it should be, what a natural disc space should be. Once all of that is done, we then determine the best fit for the implant that we're using. There are trials which allow us to size the implant and determine how it's going to fit in your disc space so that we can make the best choice. Some of the devices require a little bit of an additional prep step, meaning that we have to make some cuts in the bone to help guide the implant into the space. Once we put the implant in, we close everything up, and then you wake up and are taken over to recovery. Usually the surgery takes about an hour for one level and about 2 hours if we're doing a 2-level surgery.